Join them for their first time on the front line. One raw recruit who has dealt with genuine emergencies, paramedic Sam Duplessis Grimson. He's already treated a baby with a paracetamol overdose and a boy suffering a severe allergic reaction. Today he's on shift with his supervising mentor for the first time. It's just weeks since Sam graduated with a degree in paramedic science and passed the tough selection process to join the West Midlands Ambulance Service.
Oh, brilliant. Thank you so much.
And active duty is also a real education.
Every day is a school day in this job. I feel like I've got the skills and the knowledge to be able to deal with almost any situation that's put in front of me.
Sam's first shifts have been full of challenges, but with each emergency, his confidence has been growing.
I feel like I've earned the tabs on my shoulders, and I feel like I'm able to, feel proud to call myself a paramedic.
Today, Sam's with supervisor Mark Mearns. They'll work as colleagues, but Mark will monitor his every move. New recruits are on probation for 6 months.
They're normally more experienced sort of paramedics who've done a mentoring course. And they come out with us from time to time just to see how we're doing, see if we're sort of providing the right care for the patient.
The shift's only minutes old when the crew is called into action.
It's a red 2 call.
A red call signals an immediate threat to life. They need to get to the patient fast.
So we've got a female of 64 years who's having a stroke. That's all the information we've got at the moment. It came through 4 minutes ago.
1 in 5 strokes is fatal. The longer the delay in treatment, the greater the likelihood of death.
So it's that block of flats directly in front of us there is where we're going.
Sam's skilled driving means they arrive just seconds after a rapid response paramedic. The patient is 64-year-old Catherine. She's recently experienced a number of mini strokes, and this morning her husband Morris thinks she's suffering another.
I had a funny turn. That you can tell on my face.
Yeah, I can see, sweetheart.
But I don't want to go to hospital.
Let me do some tests. We'll see what we're looking at.
Catherine's slurred speech and the droop on one side of her face do indicate the worst. The rapid responder, who's attended to her previously, takes the lead.
Seen this lady a couple of times.
Sam assists by running tests. And they confirm everyone's fears.
Kath, sweetheart, it looks like you've had another little stroke, okay? It might be a mini one, but we need to see the doctor first to get it all sorted. There's no way around that.
The stroke means Catherine's brain isn't receiving sufficient blood.
She has got a history of sort of what they call trans-ischemic attacks or mini strokes, where you have a bit of weakness or a bit of arm weakness and then you recover. But as she hasn't recovered at this point, we're going to treat for the worst as always, alert her into Heartlands as a stroke patient.
However, despite her condition, she suddenly recognises Sam. 4 years ago, he treated her while he was a student.
I've seen you before.
Have you, my love?
It's a hopeful sign. It suggests Catherine's memory hasn't been impaired, and her latest stroke isn't severe.
Was it here? I recognise the dolphins because my sister's actually got a tattoo that looks like that clock.
However, even mini strokes are serious. 5% rapidly lead to more severe, life-threatening strokes. The crew need to get Catherine to hospital quickly.
Right, do a little dance.
As a student, Sam worked hard to build up a warm relationship with his patients. It's clear he made a lasting impression on Catherine.
When I first met Sam, he was a student, and I said to him from that day he passed paramedics.
That's good to see. Thank you, my love. Yeah, thank you.
You're welcome, Sam.
I liked seeing patients when I was a student and then sort of saying, look, I made it. So that's always nice.
He's turned out a good-looking lad.
Thank you, my love.
Putting patients at ease is an essential skill for paramedics. It comes easily to Sam. Soon they reach A&E, where Catherine will rapidly get treatment improving her chances of a positive outcome. Mark is impressed with Sam's start to his fledgling career.
Sam certainly seems to be one of our stronger new paramedics, and certainly the way he's performed so far today shows a lot of promise.
Helping people like Catherine is one of the reasons Sam wanted to become a paramedic.
It's nice seeing people it's kind of a full circle sort of thing when you see them as a student and you see them as a paramedic. And she was lovely, invited me around for tea and everything, so it's always nice to get people who want to see you. Yeah, great part of the job.
Another new recruit enjoying hard work with the emergency services is paramedic Sam. On this shift, he's with experienced crew member Martin Cummins. A GP has asked them to take an ill patient to hospital, a seemingly routine call.
We've got a 73-year-old male come through with breathing difficulties. GP is querying bronchitis or querying pneumonia. We've just arrived at the property now, so we'll go in and make our assessment.
But the paramedics soon discover the case is more serious than expected. The patient, 73-year-old Michael, has become critically ill since the GP saw him.
Morning, how are we doing today?
He has chronic obstructive pulmonary disease, a condition that kills over 25,000 people in the UK every year.
Okay, just to start doing a few bits and pieces on you, like your blood pressure and everything like that, it's all right.
Sam needs to get a full medical history, but his patient's too ill to talk. So he looks to get information from Michael's wife, Caroline.
I noticed he was having a hard time getting out of bed this morning. He was decorating all day yesterday.
What, here?
Yeah, painting all the doors and everything.
Oh, he's been doing the sanding and stuff.
Yeah.
Oh, might have irritated your lungs a bit as well.
Yeah, I can tell from his eyes he's not...
Yeah. He has got a very high temperature.
Michael's condition continues to deteriorate.
Do you know what year it is? Oh, right, not to worry.
He clearly needs urgent hospital care. Once inside the ambulance, Michael's condition worsens again. His blood pressure has plummeted, and his heart rate is too fast.
Hugo, do you want me to come back?
Yeah, it's all right for a moment.
He also has a high temperature. That could be a sign of sepsis, a life-threatening condition where the body overreacts to an infection.
I'm going to raise your legs up just to see if we can raise blood pressure first, okay? And then we'll get on the move then, all right?
Sam's training stressed the importance of staying calm even in the most critical situation.
Sam's got what appear to be a fairly severe chest infection. He's definitely dehydrated. My mate's popped a line in. I'm just going to set him off some fluids, make him feel a bit better, and raise his blood pressure and let the hospital know.
Working in tandem, the paramedics try to stabilise Michael's condition.
We're going to give you some fluids, okay? Get your blood pressure up a bit.
Then it's blue lights on and off to hospital. Just a few weeks ago, Sam learnt how to drive under blue light conditions. That training could make all the difference to this patient's outcome.
We're not far now, about 2-3 minutes away from the hospital.
Now they've reached A&E, doctors will administer the life-saving treatment Michael needs. Another shift is over. Sam's now been a paramedic for a month and thinks he's finding his feet.
I was quite terrified when I first started, and that's sort of gone away, and now I'm able to use my skills, you know, everything I've learned. I'm getting into the job and sort of settling into it.
Sam's patient Michael was treated for pneumonia and spent 4 days in hospital before returning home. And Catherine received treatment and was prescribed blood-thinning medication to reduce the risk of future strokes. All being well, she won't be seeing Sam again anytime soon.